What are hallucinations and what are delusions, and how do they differentiate? Understanding the difference between hallucinations versus delusions. What's the difference between them? Well, hallucinations and delusions are often grouped together when talking about various illnesses or conditions, but they're not the same. While both of them are part of a false reality, a hallucination is a sensory perception and a delusion is a false belief. For instance, hallucinations can involve seeing someone who isn't there or hearing people talking when there's no one around. Delusions, on the other hand, can involve someone thinking they are a celebrity when they're not, for example. And some of these conditions within this list can cause hallucinations, delusions, or even psychosis. So, what are hallucinations? Well, hallucinations are sensory experiences that one perceives as real when they're actually not. They can be caused by medications, substance use, or certain medical or mental health conditions. Hallucinations can be visual, olfactory, so your sense of smell, gustatory, taste, auditory, or tactile. Someone might think they feel bugs on their skin, hear someone talking to them, see something that isn't there, or even smell something that isn't present. Medical conditions that can cause hallucinations can include substance use, mental illness, lack of sleep, medication, migraine, seizures, social isolation, deafness, blindness, or vision problems, epilepsy, high fevers. What are delusions? Delusions are beliefs that are obviously false. They're symptoms of a disturbance in thinking. The belief in a delusion isn't accounted for by cultural or religious background. They also have nothing to do with the intelligence of the person believing them. These beliefs are held even with evidence of the contrary and despite what almost everyone thinks. Delusions can be almost anything, but common types of delusion include delusions of persecution, delusions of infidelity, delusions of love, delusions of grandeur, religious delusions, delusions of guilt or unworthiness, nihilistic delusions. Conditions that may cause delusions include schizophrenia, affective psychosis like in bipolar psychosis, delusional disorder. And what is psychosis? Psychosis is when a person has lost contact with reality. The person has disturbances in thinking and perception, and they may not know what is real and what is not. Hallucinations and delusions are often symptoms of psychosis. This is because they represent breaks with reality. How are hallucinations treated? Well, treatment for hallucinations depends on what's causing them. Medications may be used along with counseling. Specific medication that will be prescribed depends on what the hallucinations are a symptom of. Counseling can help you with insight into what you're experiencing and work with you to develop coping strategies. If the hallucinations are because of a medication, your doctor may reduce the dosage of it or ask you to discontinue it. It can be easy to confuse hallucinations and delusions. Both are symptoms of psychosis and indicate a break from reality. They also often occur together. But though the two are related, hallucinations and delusions each have their own unique symptoms. Hallucination indicate more of a sensory experience, and delusions are a false belief. There are ways to help treat and manage hallucinations and delusions. With medication and therapy, an individual can manage their symptoms appropriately. And if you are experiencing any of these things, please reach out to your doctor and share these symptoms with them so you can get the help that you may need. I hope this was helpful and differentiating the two, what they mean, what they look like, and where they can come from. I've been in and out of psychosis many times in my life, and it is absolutely something that you can come back from. Sending you all lots of love.